Autoimmune thyroiditis. This is the topic of our discussion today. This is a disease that affects the thyroid gland of millions of people across the world. And autoimmune thyroiditis is one of the reasons that a person can have an overactive thyroid gland and eventually an underactive thyroid gland. Friends, I'm Dr. Sitesh Roy, an allergist, clinical immunologist and asthma specialist, coming to you with this video on autoimmune thyroid disease. Autoimmune thyroid disease is often overlooked with patients presenting with either a very low functioning thyroid that leads them to have weight gain, lack of energy, hair fall, dry skin, constipation, sleep disturbances. There are many symptoms of hypothyroidism or a low thyroid. And unless we look for the cause on why that individual became hypothyroid, we may sometimes miss this. Autoimmune thyroiditis has also been associated with a condition called chronic urticaria, where a person keeps getting hives and itchy rashes and sometimes even swelling on their body going on for weeks, months and years. And hence autoimmune thyroiditis or even hypothyroidism needs the right kind of evaluation with the right blood investigations and then eventually the right treatment, so that these individuals can not just get their thyroid disease under control and have a better quality of life, but they can also have their chronic urticaria taken care of and not have to have nights where they are itching and waking up with itching and swelling and having all kinds of problems just because of this comorbid condition that through the immune system can also trigger problems for them. Friends, hypothyroidism is a very common condition. It tends to affect women more than men, but we also see it even in children these days. And at very young ages, we are seeing children even in the ages of 7, 8, 9 and 10 who are becoming hypothyroid for no obvious reasons, like iodine deficiency that used to call hypothyroidism before. And unless we look for the cause of the low thyroid, we may miss it. It is important to recognize that a low thyroid even at birth can cause major consequences for the baby and the infant if it is not picked up in early stages, but that is usually not an autoimmune condition and requires newborn screening for diagnosis and timely treatment. So friends, if you or someone you love has any of the signs and symptoms of a hyperactive or an overactive thyroid, such as having a fast heart rate, losing weight, excessive sweating, intolerance to heat, or any of these things, or has a hypothyroidism with a low thyroid, certainly suggest for them to see a specialist who can do the evaluation and get the right treatment done so that they can have a good quality of life. So friends, till the next time, take care, stay safe. God bless us all.